Welcome back to the channel. This is part 2. I apologize for my camera cutting out. On my last video we was talking a little bit about some of the things that's helped my MCS. I've talked to over 100 people on the MCS website, finding out what the good stuff is that helps and what the bad stuff. I kind of went over the sauna therapy, the Epsom salt. If you ain't seen the video, please go back and look at it. It's on my channel. In this video, I like to talk about two things, and I get asked these questions a lot. What products do I use? And number 2 is what medications do I use to control my mast cell activation syndrome, which is the cause of my multiple chemical sensitivity. They kind of go hand in hand. Sometimes people has both, sometimes they don't. Another word for it's Gulf War syndrome. Gulf War syndrome is linked to elevated mast cells. It also matches a lot of the symptoms, from anxiety to anaphylaxis, etc., etc. So let's get in the video. As far as products, I don't use any deodorants. I don't use any colognes. I mean, you can imagine that, and you can imagine why. I'm so sensitive, I only use about 2 or 3 different kinds of waters. I mentioned before the Mountain Valley spring water and the Fiji. I don't eat out a whole lot. Maybe once or twice a week. We talked about the Epsom salt baths. But what I wash my clothes in is I use a little bit of hydrogen peroxide, and it will help take some of the dyes and stuff out of the clothes. I like organic cotton clothes. Polyester, I tend not to do well with polyester. My pillow is polyester because it's hyperallergenic, because I do have allergies as well. But I try to space it out, use the pillow one night, try not to use it. Yeah, it's miserable. Things that you took for granted, you used to go to the store, just buy what you wanted. Hey, I like how this feels, buy it and be done with it. But now you might go through 6, 7, 10 blankets or pillows before, okay, I don't react to this one. I keep everything simple. I don't buy a lot of stuff, because if it gets contaminated with mold or something like that, when you replace your stuff, or you have to replace it, you don't have to replace a lot. I don't even buy socks. In my car, what I use to shampoo my car with, I use about 5 to 10 teaspoons of hydrogen peroxide to the whole container. I do use Free and Clear Arm & Hammer. A friend of mine on the MCS website recommended me that. I tend to do okay with it. I do use Dawn for my dishes and stuff. I know a lot of people don't do well with it. I use it to wash my car. I don't use car waxes or anything like that no more. Windex I steer clear from. I just try to just use Dawn on the windows. I heard there's something that's a little bit better called 365 it's by Whole Foods, and it's supposed to be better than Dawn. I hadn't tried it yet. Luckily I haven't had severe reactions from the Dawn, but I definitely don't use Clorox or aloe or essential oils or any of that stuff. The only soap I use Dove Sensitive Skin. Some of y'all don't do well with that. I do well with it. It leaves a residue, but what I'll do is I'll rinse a good 15 minutes before, or after that I wash off with the Dove. For deodorant, I use hydrogen peroxide. It kills the bacteria in your armpits. I spray it under my armpits, and it kills the odor. And then after that, I rinse off real good, make sure I get it off. Some doctors recommend it, some doctors don't. I do hydrogen peroxide rinses in my mouth, and it helps kill the candida out. It used to be something to use in the military to induce vomiting, so don't take it as medical advice. This is for entertainment purposes only. I'm just telling you what helps me. That's pretty much it on products. I use pretty well the minimal. I keep about 3 pair of jeans with me, 6 shirts. I wear the same pair of shoes, and I like to wash my blankets and pillows every 3 to 4 days to keep the contaminants off of it. I like 2 to 3 showers a day when I can to eliminate whatever my clothes get contaminated with. Also, medications I use. For my conditions, I use famotidine. It is an H2 blocker. I also use Claritin. That's one of the only antihistamines I do well with, since I have both mast cell activation syndrome and MCS. My MCS comes from a mast cell activation syndrome. So I take, it's not recommended, but I do kind of push it with the Claritins. I take 4 to 6 of those a day. I tend to do well. I take hydroxyzine. It's like an industrial Benadryl. I take it 2 to 3 times a day. I take prednisone. I know that's a very bad drug, but I try not to take no more than 5 milligrams a day. It tends to help with my sensitivities and the inflammation, because when I'm around things, the inflammation in my lungs just flares up. So I try to stay on the minimum of that. If I don't need to take it, I try not to take it, because it thins your bones, you hair loss. It's all kinds of bad things that the prednisone does, but prednisone blocks the inflammatory responses in your body, like the cortisol that your liver makes. So it works well for a lot of MCS people, but also has the chemical load. But I'm using this because I don't have a safe, really a safe place for my MCS. Now, I use chromium sodium. It's mostly absorbed by the stomach. It doesn't help other parts of the body so much, so I use that in oil form. I see a little bit of benefit. I've experimented with some other mast cell stabilizers, and I use clozapam low dose. I just started it, and it kind of helps. It's Ativan and clozapam is a mast cell stabilizer. It's used for anxiety, but I don't take it for anxiety. It's multiple uses. It's like seizures, anxiety. It's a mast cell stabilizer for focal seizures. For some reason, the Ativan done better, but they put me on clozapam. I'm on the lowest dose, 0.25 morning and evening. I do well with it. It doesn't cure me by no means, but it does kind of help me if I'm around something that's real strong. It helps me recover a little bit faster. It's just kind of like a crutch. It doesn't mean you can go back to spraying bleach like you did before, or using Tide. It's not what it's for. It's just to kind of help you have a little bit of a normal life. Control disease, not cure disease. It's just a quality of life thing. I have inhalers, all that stuff. It don't do any good, because this is not my typical asthma. I had asthma for all my life. I know when I got this, I know it wasn't nothing like my asthma or my regular IgE allergies. Yeah, that's pretty well it what I use. Don't take no more than what you have to. Listen to your doctor. Get in functional medicine. Find one that wants to talk to you. They want, if they're talking money on the first visit, stay away from those. If they want money, if they're telling you, if they're the kind of doctor they call and they talk to you when they don't have to talk to you, that's the kind of doctor you need. There's a few like it. Dr. Stephanie McCarter in Dallas. I know Dr. Matos has been really great to me. He's called me when I've had my low points, and if they don't have their hand out every time that they give you a little piece of advice, that's the doctor you need to be in and seeing. But if you go to these telepaths or whatever, and they don't even want to talk to you, and they already want money, stay away from those. But it is good functional medicine doctors out there. They're not all quacks. But yeah, I pretty well wrap this video up. Y'all got questions, like, share, subscribe. I have a Facebook page. It's called Go Getter Stroop. Feel free to message me, reach out. You got questions? Oh yeah, one more thing. The Mountain Valley water. You can get it at Food City or you can get it at Whole Foods. It's the two places I usually find it. Try to get the non-carbonated. It's a little bit better than the carbonated. But God bless y'all.